Here we are with the microscope, and what I'm going to show you is just what things look like from my point of view. So for reference, I'm just going to take a normal 5p coin that everyone kind of knows the size of, and just use a little file which we might use in the retreatment side of things so that you can see roughly an idea of scale for what's going on. Two great things that it does is it lets us zoom right in on things that are really quite small. Looking at this 5p coin, so we can see it just in really high detail. The other thing the microscope lets us do is it brings a lot of light into the tooth. So the tooth is naturally sort of quite dark, especially on the inside and down in the roots. And the microscope gives an amazing light as well as making things really clear. If we zoom right in here on the 5p coin, you can see a lot of detail that you probably can't see normally. I'm going to bring this little file in just to give you an idea of kind of scale of what we're looking at. So that's an 800th of a tenth of a millimetre. That's sometimes the kind of scale that we're looking at to try and find the top of a root canal system. So that's why the microscope is really useful, because it helps us be able to see these tiny little points. You can see kind of in relation to the size of a 5p just how small some of these bits are that we're looking for. In use of the microscope is going to be that, just to help us see things really clearly and find anything else going on in the tooth. It's also useful because some teeth have got little cracks and fracture lines in. Sometimes it means they're not saveable. You can't normally see that if you're just looking just sort of direct vision, but if you found a little crack line, say like the little line coming down here, that might not be visible with the naked eye, but you can see it a lot more clearly under the microscope, and that's what we'll be using it for. So again, if you see this when you're in, don't have any concerns about it. It's just to help us give you the best possible treatment that we can.